Many people reach their 70s and suddenly feel they're juggling more health advice than ever before. Perhaps you've noticed this yourself. One doctor says to cut out a certain food, another recommends a new pill, and there are always neighbors sharing their own remedies for staying strong. It can be overwhelming. Yet among all the chatter, one piece of guidance has stood out for decades. Take a low-dose aspirin every day for your heart. Then we started hearing mixed messages. Some experts seem to backtrack, suggesting that aspirin might not be as helpful for everyone. It's no wonder many seniors feel confused about what to do. You may worry about heart attacks or strokes, especially if you have a family history of heart disease. You might also be dealing with the everyday struggles of aging: stiff joints, slower movement, perhaps more fatigue than you used to have. When life already has its fair share of challenges, adding one more pill could feel like a gamble. Is it truly beneficial, or might it introduce complications like stomach ulcers or bleeding problems? These are real concerns, and they deserve thoughtful consideration. Still, ignoring heart health because it's complex or confusing isn't the answer. Cardiovascular disease remains one of the most significant risks we face as we get older, and the choices we make can have a profound impact on our longevity and quality of life. Maintaining a healthy heart isn't just about living longer, it's about living better, staying active enough to play with your grandchildren, travel comfortably, or simply keep up with your favorite hobbies. In a moment, we're going to clear up the confusion around low-dose aspirin by taking a deep look at why it might actually offer renewed hope for those of us over 70. We'll talk about what aspirin really does for your heart, examine the potential rewards and risks you need to keep in mind, and explore practical tips to help you figure out if daily low-dose aspirin fits into your personal plan for a healthier future. By the end, you'll have a roadmap that can help you speak confidently with your healthcare provider, rather than feeling like you're just taking yet another piece of advice on faith. It's important to know that every piece of information you'll hear today comes from a place of deep respect for your life experience. Nothing here is intended as medical advice. Only your doctor can advise you on the specifics of your situation. But I've watched many seniors successfully incorporate changes that support their health goals. The knowledge we're going to share could help you become one of those success stories, creating more vitality and independence in the years ahead. Take a moment to think about your current heart health concerns, or perhaps the concerns of a loved one in your family. Do you ever wonder if there's a simpler path to feeling confident about your cardiovascular well-being? Let that question guide you as we explore why doctors are taking a fresh look at low-dose aspirin for folks in their 70s, how it might be beneficial for your heart, and what practical steps you can take today to protect both your physical and emotional well-being. Let's begin by challenging some common assumptions we've held for far too long about aspirin's role in heart health. Once we look at the facts and the lingering misconceptions, you'll see that there's genuine reason for optimism. Many people have heard that low-dose aspirin is outdated or even dangerous. The truth, however, is more nuanced, and it just might open a door of opportunity for you. Our first major focus is a basic question that continues to puzzle a lot of seniors. Why has aspirin remained a topic of conversation for heart health after all these years? And what part of the story are we missing? When most seniors think about aspirin, they likely picture those teeny tiny pills that have been on pharmacy shelves for decades. Aspirin often gets lumped together with basic pain relievers, so we sometimes forget it has specific properties that can help reduce the formation of blood clots. For some older adults, this benefit is immensely valuable. Yet many seniors also worry about hearing that aspirin can be risky, especially for those dealing with digestive issues or taking multiple medications. It might make you wonder, if aspirin is supposedly so beneficial, why am I hearing about potential problems too? A key misconception is that aspirin either works for everyone or it's outright dangerous. The reality is that there's a middle ground. Aspirin's main action is to interfere with how platelets in the blood clump together. This is crucial in preventing clots that can lead to heart attacks and strokes. But the same mechanism can increase the chance of bleeding. The good news is that when prescribed appropriately, particularly as a low-dose option, aspirin can tip the balance in favor of better heart protection, provided it's used under medical guidance. Let's consider someone like Marion, who is 72 and has managed relatively good health her entire life. Marion only recently started grappling with higher blood pressure and cholesterol levels, issues many seniors encounter. Her doctor mentioned that low-dose aspirin might help protect her heart. Immediately, Marion felt a wave of anxiety. She was taking medication for blood pressure already, plus vitamins, plus a supplement for joint pain. She worried, am I just adding more pills to my list without real benefits? What shifted her perspective was learning about the unique way aspirin prevents clots. Marion discovered that it wasn't about treating a single issue, like a headache, but about adding a tiny but steady shield against clot formation, especially when combined with other heart-healthy habits like moderate exercise and a balanced diet. Her doctor explained that because Marion's blood pressure was under control and her family had a significant history of heart disease, a low-dose aspirin could be a helpful part of her broader approach. Marion's nervousness turned into cautious optimism when she realized this wasn't about adding medications blindly. It was about finding a protective measure that fit her life and risk profile. From an evidence-based standpoint, medical professionals often recommend low-dose aspirin for what they call secondary prevention, meaning for people who already have a history of heart events or conditions like stents or bypass surgery. However, a growing number of discussions also address how aspirin might help some older adults who haven't had a heart event but carry certain risk factors. The latest research is nuanced. It suggests aspirin isn't for everyone, but if you fall into a category where arterial plaques or clot risks are higher, that daily dose could help tilt the scales towards safer blood flow. One practical piece of advice is to schedule a thorough medication review. Before you introduce aspirin or any other new regimen, get all your current medications, supplements, and vitamins on the table. Literally. Sit down with your doctor or pharmacist and go through them. This is especially important for seniors, as the risk of drug interactions and potential bleeding increases if you're already on blood thinners or certain anti-inflammatory medications. By having a complete picture, you can work with your healthcare provider to decide if a low-dose aspirin is genuinely beneficial for you, or if the downsides outweigh any potential gains. Physically, the immediate benefit you might notice from adding a low-dose aspirin could be minimal. After all, you won't feel plaque being prevented from building up, the way you might feel relief from a headache. But over time, you could experience greater peace of mind, a steadier sense of energy because your cardiovascular system is in better shape, and more confidence to engage in activities without that nagging fear of cardiac incidents lurking in the back of your mind. Emotionally, knowing you're taking a proactive step that leading heart experts often recommend can offer a sense of empowerment. Seniors sometimes feel as if they're losing control over their bodies with every new ache or diagnosis. Implementing a carefully chosen regimen, like a simple daily pill, can counter that feeling. Of course, it's about choosing wisely, which is why staying in touch with your doctor is vital. Before moving on, consider how you relate to Marion's story. Are you someone who's been avoiding the topic of aspirin altogether, or have you been curious but hesitant to ask your doctor for more clarity? Take a moment to reflect on what holds you back. Sometimes the fear of just one more pill can keep us from discovering a genuinely helpful option. If you've got questions, jot them down. Use these as a starting point at your next appointment. Taking that first small action can pave the way for the hope and opportunity we're exploring today. Now you might be thinking, all right, so aspirin can help with clotting, but what about all those horror stories I've heard about stomach bleeding? Is it really worth the risk? That's a fair question, and it leads us straight into our second major discussion, which looks at balancing the benefits of low-dose aspirin against the potential risks in a more comprehensive way. We often believe that once we hit 70, our bodies become too fragile to handle certain medications. That's not entirely accurate. Our bodies do change, but they're also capable of adjusting to the right treatments when approached carefully. The second big misconception is that low-dose aspirin is all risk and no reward, especially for older seniors. In reality, whether you reap the reward often depends on how well you manage other factors, such as diet, activity level, and medication monitoring. Take George, for instance. He's 78 and has lived with type 2 diabetes for over 2 decades, along with slightly elevated cholesterol. A while back, he developed heart palpitations that his cardiologist said weren't life-threatening, but signaled a need for closer monitoring. When the subject of aspirin came up, George immediately balked. He'd heard a friend's story about emergency surgery due to a bleeding ulcer, and he worried he might share that fate. After all, when you're 78 and living with multiple conditions, it's easy to picture the worst outcome. But here's the twist. George's cardiologist explained that many of these risks can be mitigated if you take steps such as pairing aspirin with certain protective medications, for example, a proton pump inhibitor, to shield your stomach lining. Also, careful dosage, often 81 milligrams of aspirin daily in the United States, can significantly reduce complications compared to standard full-strength aspirin. George's primary care physician added that because George's diabetes put him at higher risk for cardiovascular problems, this protective measure, alongside his other medications, could be an important line of defense. Evidence-based insights show that, in the right context, the small increase in bleeding risk from low-dose aspirin can be outweighed by the reduction in heart attack or stroke risk. The balancing act becomes a game of risk versus benefit. This is why it's so critical to speak openly with your healthcare provider and possibly even a specialist like a cardiologist. You want someone who can look at your entire medical profile, everything from blood sugar control to kidney function, and determine if you're a good candidate. If you're thinking about taking actionable steps toward aspirin use, here's a practical approach. Keep a detailed log of your current health measurements: blood pressure, blood sugar if you're diabetic, cholesterol levels, and your everyday symptoms. By having this information organized and readily available, your doctor can more quickly assess whether you fall into the group that stands to gain from an aspirin regimen. If the conversation ends with a mutual decision that aspirin's not right for you, that's still valuable clarity, and you'll know you've explored the option thoroughly. Beyond the physical benefits of reducing the risk of serious heart events, there's an emotional relief that comes when you're making informed decisions. George, for example, described feeling less anxious about his daily routine. No longer did he interpret every flutter in his chest as a looming sign of a major cardiac event. When you reduce that constant background worry, you free up mental energy to enjoy life more fully, whether it's spending time with loved ones or pursuing hobbies you might have sidelined. Of course, you'll want to remain vigilant. Even if your doctor prescribes low-dose aspirin, it's crucial to learn the warning signs of potential bleeding issues. Let your healthcare team know right away if you notice unusual bruising, blood in your stool, or persistent stomach pain. Early detection of side effects can prevent them from escalating. If you still feel hesitant at this point, you're not alone. It's normal to question whether a single pill can truly make a difference. But the real power of aspirin isn't about it being a magic fix. Instead, it's a supplemental measure that works best when your broader lifestyle is geared toward heart health. This means being mindful of what you eat, how you move, and managing stress levels, areas where many seniors experience the push and pull of changing habits. Now is a good time to check in with yourself again. If you've listened to everything so far, do you find it resonates with your experiences? Maybe you're recalling a time you brushed off the idea of aspirin because it sounded too risky. Or perhaps you tried it once but didn't follow up with your doctor to see if it was still needed. Whatever your story, understanding the bigger picture is key. You can do something about your heart health that feels proactive and hope-filled without letting worry about the worst-case scenario hold you back. If you have a friend or family member who's also curious about this, encourage them to watch alongside you or share what you've learned. It's often easier to take the next step when someone else is on the journey with you. Compare notes, support each other, and commit to a health check-in session with a professional. That small act of mutual accountability can keep you moving forward. Let's transition to the final piece of the puzzle: how you can go about integrating aspirin, if it's right for you, into a broader heart protective routine that respects the unique challenges of aging. The goal is to embrace a more holistic plan, one that goes beyond medication and touches on your diet, your emotional well-being, and your sense of freedom in daily life. There's a common assumption among seniors that doing more for your heart means more complicated treatments and major lifestyle overhauls. The misconception here is that aspirin, or any single measure, stands alone. In reality, whether low-dose aspirin leads to meaningful heart protection often depends on how well it's woven into your larger routine: nutritional changes, activity adjustments, and regular checkups. Meet Angela, who's 75 and lives in a retirement community where she has access to group exercise classes. Angela began taking low-dose aspirin on the advice of her doctor after a mild stroke 2 years ago. At first, she just added the pill to her morning lineup. Then she realized it wouldn't do much good if she kept ignoring her doctor's advice about diet and exercise. That's when Angela made a pivotal shift. She started a gentle walking routine that gradually increased to 20 minutes of daily walking, joined a weekly Tai Chi class for balance and flexibility, and chose more vegetables and lean proteins at each meal. In a matter of months, Angela noticed she had more stamina, less joint pain, and a noticeably brighter mood. Physiologically, aspirin helps by reducing the likelihood of clot formation, but that doesn't exist in a vacuum. If your arteries are still under assault from high cholesterol or uncontrolled blood pressure, or if your activity level is so low that circulation remains sluggish, aspirin's effect is muted. Combined with moderate exercise, however, your heart and blood vessels can become more resilient. Exercise helps improve circulation and strengthen the heart muscle. Aspirin then quietly supports these gains by lowering the risk of blockages. Think of it as a team effort. A practical step to take is to create a medication and activity calendar. Note down the days you take your aspirin, along with any other medications. Include your exercise sessions, whether it's a short walk, a swim, or a dance class in your community center. This way, you have a simple visual reminder to stay consistent with both the medication and the lifestyle factors that amplify its benefits. Over time, you might see patterns like feeling more energetic on days after a good walk or sleeping better after engaging in light stretching. This tangible evidence can motivate you to keep going, reinforcing that small daily choices lead to meaningful results. Emotionally, when you start to experience improvements, maybe your legs feel stronger, or you realize you're walking faster without getting out of breath, you build momentum. Each small victory helps reinforce the belief that you're not powerless against aging. Angela found herself more excited about her morning walks because she had an extra layer of confidence, knowing she was doing something proactive for her heart. Of course, life isn't always a neat progression of successes. Some days the aches and pains will linger, or you might forget to take your pill. Perhaps you'll have a setback due to an unrelated health issue. The key is to maintain open communication with your healthcare provider. Regular checkups are essential for adjusting your aspirin use if needed. As we age, our bodies change more rapidly, and what worked a year ago might need tweaking today. If you run into barriers like a knee problem that makes exercise tough, ask about modifications. Could a physical therapist suggest gentler moves or water-based exercises? If preparing heart-healthy meals is challenging, look into simple meal delivery options or coordinate with neighbors to swap healthy dishes once a week. Seniors often have more resources at their disposal than they realize. It's just a matter of exploring what's out there. Finally, don't underestimate the role of a positive mindset. Aspirin can't do the job alone, and negativity can sap your motivation to keep up with a healthy routine. Try framing your daily aspirin as a reminder of all the other positive actions you're taking for yourself. When you swallow that little pill, let it nudge you to check in on your posture, do a few stretches, or plan a short walk. Small rituals add up to significant changes over time. It might sound like a lot, but remember that every journey starts with a single step. Maybe your first step is as simple as placing your aspirin bottle next to your favorite morning cup so you'll see it each day. Or perhaps it's calling a friend to join you for a daily walk. The goal is to create a realistic routine, something you can see yourself sticking to for the long haul. This routine, combined with your doctor's guidance, is where true heart protection happens. Now that we've explored how to fit low-dose aspirin into an overall heart-healthy lifestyle, you might be feeling more hopeful or at least curious. We've talked about the misunderstanding around aspirin's function, weighed the risks and benefits, and looked at how to integrate it into day-to-day life in a practical, manageable way. The next question is, how do you turn all this knowledge into real results in your own life? Let's move toward wrapping this up with a clear call to action so you walk away with a sense of direction rather than just information. We've covered a lot of ground, and by now you have a clearer sense of why doctors continue to highlight low-dose aspirin for some seniors over 70. The potential for clot prevention remains significant, especially for those with certain risk factors. And the real-world examples we've discussed show how it can work in harmony with other lifestyle changes. Yes, there are legitimate concerns, such as increased bleeding risk. And no, aspirin isn't a one-size-fits-all solution. But for many people, especially those prepared to pair it with mindful living, it might well be the missing piece of their heart health puzzle. Time can be of the essence when it comes to heart health. Conditions like high blood pressure, diabetes, or cholesterol buildups don't stay static. They often progress if left unattended. The reason to act sooner rather than later isn't to scare you, but to emphasize that small changes made now can have a huge payoff. The longer you wait, the more those conditions can sneak up on you, sometimes leading to complications that could have been prevented. Try envisioning how different your life could look a year from now if you took steps to improve your cardiovascular wellness today. Maybe you'll have more energy to attend social gatherings, chase grandkids around the yard, or even book that trip you've always wanted. Feeling less weighed down by worry can open doors to a richer, more engaged life. Here's a simple, layered approach to taking action, depending on what feels right for you. First, at the most basic level, set up a talk with your primary care provider or a cardiologist. Bring a list of all your current medications, along with your questions about low-dose aspirin. Share any family history that might increase your heart risk. If you're comfortable, consider asking about a full cardiac risk assessment, which could help your doctor give you more tailored guidance. Second, if you decide with your doctor that low-dose aspirin is a good option, create a straightforward system for remembering your daily dose. It might be as simple as using a pill organizer or setting an alarm on your phone. Consistency is key for reaping aspirin's clot-preventing benefits. Third, deepen your engagement by setting one additional heart-healthy goal that pairs well with aspirin. That might be committing to a 15-minute daily walk, swapping one high-sodium meal a week for a home-cooked dish with fresh ingredients, or exploring gentle stretching exercises. Choose something achievable that brings you a bit of joy. Finally, share your experiences with others, family members, friends, or fellow seniors who may also be in a place of uncertainty. You might be surprised how many people face similar questions, and your story can inspire them to pursue their own path to better health. This sense of community not only helps you stay accountable, but also turns individual decisions into a collective movement toward happier, healthier aging. Above all else, remember that you are an active participant in your health journey. Aging can sometimes feel like a slow surrender, but it doesn't have to be. You have decades of wisdom, life experience, and resilience to draw upon, and those qualities are invaluable when navigating modern healthcare options. Low-dose aspirin is one tool among many. Use it wisely in collaboration with trusted professionals, and you might just discover a brighter horizon than you expected. If this message has sparked even the slightest feeling of hope or curiosity, hold on to that. The next step is up to you. Have that conversation with your doctor. Start that walking routine and take control of how you age. A healthier heart means a more active, fulfilling life at any stage, and it's never too late to begin. With the right balance of caution and courage, you can open the door to opportunities that keep you thriving for many years to come.